When some high schoolers returned from holiday break, they were greeted with free condoms. That's right, 1/3 of Philadelphia's high schools will now be home to new, clear, plastic condom dispensers. That's new and clear, not nuclear. Installed inside the nurse's office. The new move aims to increase access to students in a city where teens comprise 25% of new HIV infections. Finally, the district has addressed public health in a way that is modern, that's realistic, and that is proactive.
I think when you turn schools into truck stops, that's a pretty huge concern, and we're very, very much against enabling students to have access to these, and just the message that the school is giving to these students, saying, look, we know you can't control yourself, so take action and use these condoms. Instead of saying, we expect a lot better of you. We know you can control yourself, and you know what? I think that sexual activity should be preserved for marriage, and you're going to really sideline your future here if you continue to be sexually active. If we're talking about sex between a man and a woman, then at least if the lady becomes pregnant, that child is born into a family. If a young lady has sex outside of marriage, the guy usually walks off because, you know what, he doesn't want to deal with the responsibility.
Some of the numbers even suggest that 50% of teens are already sexually active, and 2/3 of these teens may have had sex before their senior year of high school. So the teens are having sex. The message that should be sent is that we want you to protect yourself. Condoms are very effective in reducing pregnancies, reducing HIV infection, and reducing other STIs. It's a fact.
But what we're saying is that if you're going to provide condoms, one, you should notify parents and let us opt into it. And two, there should also be comprehensive sexual education that goes along with it, because condoms do not protect you 100%, and we want our children to be responsible.